panelists. Dr. Ross Walker, preventative cardiologist from Sydney, Australia. We met Dr. Walker earlier. Dr. Walker is the president of the Gut Foundation of Australia and is a non-executive director for MGC Pharmaceuticals, a company researching, developing, and marketing medical cannabis around the world. He's also the patron of Heart Support Australia. We have Dr. Christopher Jensen, longevity specialist and medical business consultant from the UK. Dr. Jensen has a keen special interest in the practice of personalized medicine and its integration with complementary and holistic wellness to improve immune function and the prevention of chronic disease using proper physician stress reduction protocols, exercise, and nutrition programs. Dr. Ursula Jacob, medical doctor and scientist in preventative medicine from Munich, Germany. Dr. Jacob has practiced rejuvenation medicine for more than 20 years, and after several years in various medical establishments, Dr. Jacob is now the proud founder and owner of Day Clinic for Prevention and Regeneration located in Germany. Next, Assistant Professor Dr. Patana Tengamnoi, nephrologist and anti-aging specialist from Bangkok, Thailand. Dr. Patana rejoins us in this session. He is a well-known lecturer about nutraceutical supplements, stem cell biology, and anti-aging medicine. He serves as an assistant professor in anti-aging and regenerative program of Turkit Bandit University. And last but not least, I'd like to introduce our speaker, Assistant Professor Dr. Mat Mai Prasert, anti-aging and regenerative medicine specialist, also from Bangkok, Thailand. Currently, Dr. Mat owns a private practice at S-Mart Clinic here in Bangkok and also serves as program director for the Master's degree of Science in Anti-Aging and Regenerative Medicine at Turkit Bandit University. This session, ladies and gentlemen, will be moderated by Mr. David Bohm, chairman of Miskawan Health Group. So how about a big round of applause, please, to welcome our speakers and moderator.
Thank you very much, Honey. And thank you again, everybody, for being here today. We've got one of the most esteemed panels I think one could imagine on health spanning that you could have anywhere on planet Earth and certainly in Thailand. So we have half an hour to talk about health spanning, and I guess we should follow protocol and ladies first. So Dr. Ursula Jacob is here from Munich in Germany, one of my dear friends. And Dr. Jacob, I thought that considering you told me you've seen a lot of conditions in your clinic from patients who have come with conditions after receiving being infected by viruses, one virus in particular that's been quite well known around the world. And we thought that what would be the best you could give our audience some advice on how to condition your body to avoid the maximum impact of these viruses that you've seen examples of in your clinic. And please let us know some examples as well. Thank you, Ursula.
Thank you very much for this kind introduction. And I'm very happy to be here to join this Congress with all of you. So my medical background is I'm coming from oncology, worked there for a long time. And the question always was why oncological conditions coming up. And as the speakers already explained, there is a lot of environmental problems, external problems, psychological issues, but also we carry in us a whole zoo of bacteria, viruses, funguses, what at a specific way we need to survive, and they coordinate in a very smart way the biochemical processes in our body. But sometimes if something goes out of balance, then they can come up. And what I see, and it's increasing nowadays, is that lately through COVID as well, we are more alert to put an eye on our immune system and on our self-defense mechanisms. And we heard already a lot this morning from the gentlemen about how to do it over diet, or we will go more, I think, intensively in this about the gut system. And what is important, and I agree with the speakers before, is that you by yourself has to take over. You cannot release the responsibility to your doctors or to others. First, you have to look for yourself to build a kind of defense. You have to see that you eat good, you exercise, and at the end of the day, you have to take care of your immune system. And this you can do in protecting, for example, the outer system and It starts at the end of the day with the skin, because the skin is the biggest protecting organ what we have from the outside to the inside, and the mucosal layers in our nose, sinuses, mouth, where we have a lot of good bacteria, what we really can train with alkalining the mouth, for example, or for sure you know about when you can take like oil inside in the morning time to clean the mouth, to make the barrier stronger and to detox. So there are a few things starting as well with the hygiene of our teeth. And very often we forget about the teeth, because these is a very important part of our body. And I guess you know that every teeth is connected with inner organs. So when the teeth are not okay, or when you have root canals or fillings or whatever, it definitely affects our system. So this is why, coming back to before, you have to take care of yourself to keep your skin in a good way, in a kind of order, and your mouth and the teeth. And the skin, and this is what we see now increasingly, shows. And if the skin shows something like eczema, rosacea, psoriasis, also dry skin, it's an SOS to the body that something is wrong. And what we're seeing coming up now after Corona is that people who never had problems with the skin suddenly get eczema, suddenly get dry skin around areas what are correlated to the metabolic systems, detox organs. And I think this is where we have to take care of. And we go surely in the next few hours more in depth with the different colleagues making the programs. And what I want to point out, and you will hear it a little later, is we need to keep our immune system alert, that it keeps a balance in our body of viruses and bacteria what are living in us, what we need as a kind of training for the immune system. But when they are coming up and getting more aggressive, then it comes to the point where they try to take over and suppress our immune system. And this is where then, with different tests or whatever, you can be helped. But the best is always to keep your diet in a good way, to exercise, as the colleague says, to keep the weight stable, and to keep your metabolic system in a kind of stable way.
Thank you, Ursula. And I think you mentioned exercise, and one thing that Dr. Patna mentioned during his talk, which really intrigued me, and you were talking about intermittent fasting, Dr. Patna.
Yes.
And you mentioned that during the period of intermittent fasting, there should only be light exercise. Mm-hmm. So I tend to have an early dinner and eat very late in the morning, as you recommend, but I like to go jogging in Lumpini Park in the middle of that. So,
every day?
Not every day, only
Okay.
a couple of times a week, because I'm not that healthy. My legs aren't that healthy anymore. But I'd like, Dr. Patna, if you could expand a little bit on exercise and, how much exercise should one do, especially as one gets older, and is there a chance that we might overdo it?
Okay. Exercise for everybody, especially someone who is getting older, actually is something we call core exercise. Okay, for Thai people, read my lips, because core in Thailand means neck. Okay, core exercise in this case means the back exercise and the leg exercise, not neck exercise. Okay, all right, core exercise. This is a simple exercise that doesn't need a lot of energy, so you can do fasting while you exercise. Okay, I'm not talking about jogging, sorry, David. I cannot stand here anymore, I'm too short. Okay, let me show you some simple exercise. For example, you can move your feet up like this and down. Change your legs up and down 20 times. It's very simple.
Do it together.
One, up. Change your legs. Okay. This is a simple core exercise. Okay. So, of course, you can do fasting when you wake up. All right. You don't have to do 20 times. Another thing, of course, is that you twist the body. Okay. Open your favorites, whatever Madonna songs or whoever, Justin Timberlake, my favorite songs, Sam Smith, if you might, and start twisting. So a lot of core exercise you can do during fasting. It's not too heavy, but the important is the back exercise and core muscle exercise.
Thank you, Dr. Patna. And Dr. Mart, when you talked about the functional medicine approach
Yes.
to keeping people healthy, and I think everyone had the same theme, starting from the very origin of Miskulwan Health, that the best doctor is your own body, and you talked about a systems-based approach to healthcare. So I wonder if you could just, that was intriguing for me because I'm by profession an accountant, so I always look to follow systems. So how does systems-based approach work in medicine, in your opinion?
But you asked me about
Yeah,
how.
so you mentioned that we should use a systems-based approach in functional medicine.
Yes.
So how does that actually apply in treating your patients? The systems
How to
approach.
apply?
Yeah.
I think that most of my patients focus on the symptom, and the first visit of the patient to me, they will face the different approach from the conventional medicine. So I must tell my patient first that for the conventional medicine, the success depends on the doctor 80% and depends on you only 20%.
Right.
But for the anti-aging and functional medicine, the success of the treatment depends on you 80%,
Right.
and on me only 20%. So you must understand whatever that you do, you must know that what you eat, what happened after that, and when you do this thing, what happened after that. When the patient understands, so the difficult part of this kind of medicine is education,
Yes.
and how to change their mindset is really important.
Yes, I think you're right. Education is the key, Dr. Mart, and I think that's something that my good friend Dr. Christopher has been very much involved in since he came to Thailand, is to educate the population in general and the patients in particular as to how they need to be involved in their own health. And Dr. Christopher, how would you think that we can expand the education of functional medicine to the community in general?
First of all, thank you very much for inviting me, and I'm honored to be amongst such an incredible group of doctors, scientists, and people representing all of the interests that we're trying to bring forward. I come from a background of emergency medicine and surgery, which are two parts of medicine where we concentrate very quickly on disease that's already happened, problems that are in front of us. Instead of looking at what I've been trying to do for the last 7-8 years, really is really looking at how do we change the paradigm, and the paradigm starts with education. It starts from how we learn very early on, whether we're a nurse or a doctor, a physiotherapist, health policy people, about what and how we change the paradigm so that we're learning earlier on about the things that will prevent illness, so that we're not striking illness when it's already upon us, as my friend and colleague Dr. Walker elucidated earlier. So in terms of how education will shape and how we might change the way functional medicine is understood, is one of the big impacts, of course, is economics, right? If we look at a downstream situation where a patient is picked up already sick, from an economics standpoint, we're obviously making it very, very difficult for that patient and for the system that's caring for that patient. So if we're looking long before that, we're looking at the patient as a whole, as a holistic whole, and we're looking at how to make that patient feel a lot better earlier in life. We're talking about, from a very young age, already teaching people how to eat properly, how to exercise properly, how to look and work to sleep the best that they can every night. These are the activities of daily living that we sometimes forget. It's just the impact of stress and putting stress on even on our young ones, what that effect is having on us. And we see that in social media, we see that in a lot of the obesity epidemics that are overwhelming the world, and of course we see that in the way that we eat with lots of complex problems. So again, functional medicine looks at the root cause. And aging, and I'll talk about that later in my chat. Aging is, as Dr. Sinclair says, something that we should be looking at early on as a disease. And if we look at it early on as a disease, we'll see that the root cause of disease is actually as we age, because aging is causing the majority of the diseases that we can actually prevent. So in terms of your question, I think it's very clear that the earlier that we can get to people, and I'm talking about young people, but I'm also talking about people my age that haven't understood all of this up until now. The earlier we can get to them, and the earlier we can teach them, and the earlier we can teach the importance of adherence and compliance. So it's not just what you do today, it's what you do 6 months from now, 12 months from now, a year and a half from now, and how you keep up with the things that you're learning. Because we can teach you, but then you very quickly can forget. So we need to keep teaching you. We need to keep teaching each other. We need to keep teaching each other how to make this world a better place, and it all starts with education.
Yes, thanks, Christopher. That's exactly true, and I think you're right. We all have to keep teaching each other and reminding each other that the way it's been done is not necessarily the way we should go in the future. And I think a common theme amongst the speakers this morning was that in the modern health system, we have an approach that take a pill for what ails you. And I think a lot of us have been conditioned to that system. I think that each of our doctors had an example of a patient that had been suffering greatly from that symptom. And so I think we have to try and think about taking less chemical drugs. And every doctor who talked already this morning has said the same thing. And one drug that is very well prescribed, maybe not well prescribed, but prescribed very often, is statins. And I know Dr. Walker spent a bit of time talking about statins, but you mentioned, Dr. Walker, that there should never be a statin for someone who presents to you without any risk and a low calcium score. I think the audience would love to hear a little bit more about, because probably a lot of them are on statins and probably incorrectly on statins. Yep. If you could just tell us a little bit more about your philosophy of treating people and whether to use statins or not.
Yeah, well, I believe statins are the most overprescribed drugs on the planet. And there's, in my country, I'm not sure what it's like in Thailand, you go into a doctor, your cholesterol's high, immediately you're put on a drug. In the US, 1 in 3 people over the age of 45 have been prescribed statins to lower their cholesterol. And you think about what that means. We're taking a strong synthetic drug. And sometimes, and I'll tell you a couple of stories about this. I think stories are better. These are not clinical trials, but they're very interesting stories. I saw a 38-year-old man who some fool had put on a statin when he was 28 because his cholesterol was high and his uncle had a heart attack when the uncle was 55. That was the justification to put this man on a statin. For the next 10 years, his wife went through 10 unsuccessful cycles of IVF until it twigged in this guy's head there was possibly the statin he was taking pulverising his testicles and not allowing his wife to get pregnant. So he stopped the statin against medical advice, not mine, against another doctor's advice. Within 6 months, his wife got pregnant naturally. Now, I'm sorry, ladies and gentlemen, that is medical negligence. To put a family through the misery of failed IVFs, not once, not twice, 10 times, when the man was on a drug that, when he saw me, I deemed he didn't even need it in the first place. So this ridiculous, my cholesterol's high, doctor, take a pill, is nonsense. Find out if the cholesterol is spilling into the walls of your arteries. Have a coronary calcium score. It's a very, very simple, painless, inexpensive test that will tell you what your risk is. So I don't treat cholesterol at all. I treat risk. And here's another thing about cholesterol people don't realise. Everyone's heard of LDL bad, HDL good. That is simplistic nonsense. LDL and HDL, and even this is too simplistic, but it fits for this discussion. LDL and HDL are divided into small bits and large bits. And here is where size is important. The larger the better of LDL, the larger the better of HDL. So if you have small LDL, that is the bit that is pro-atherogenic, puts fat in your arteries, gets easily oxidised. That's the bit you want to control. Large LDL is actually good for you. It builds healthy cell membranes, cell metabolism, brain function. It's the basic ring for steroid metabolism, vitamin D, bile salt metabolism. Large HDL pulls fat out of your arteries. Small HDL is pro-inflammatory. So when you look at somebody who has modest cholesterol level, high triglyceride but low HDL, their cholesterol might look all right. They have more small LDL and small HDL. And doctors are ignoring that. But then a healthy person in their 40s and 50s goes in with a cholesterol of, say, 300, this is what you might use here, but an HDL of 70 or 80, and a low triglyceride, and immediately they're put on a statin. And no one's looked at their arteries, which are probably completely normal, and then you see over months to years people getting problems. And here's the issue. What statins do typically is deplete a thing called coenzyme Q10 in your mitochondria. Now, what are the mitochondria? The mitochondria are the fuel packs of the cell. So it doesn't matter what sort of flash car you drive, if you have no energy in the car, it doesn't move. Coenzyme Q10 is one of the major drivers of the mitochondria. So when you take a statin, you're depleting coenzyme Q10 in your mitochondria. So you start, you feel okay, but after a few months to years, you start to feel tired. You start to feel achy. You don't think as well. And you think, I'm getting old. No, you're not. You're getting the side effects of a drug. So everyone I put on a statin who's got a calcium score that's high or they've got established heart disease, I always put them on ubiquinol, which is the active version of coenzyme Q10. Because when you hit 50, the enzyme that converts you from standard Q10 to ubiquinol starts to drop off. You must take the active version, ubiquinol. So I give them the Bergamet, I give them ubiquinol. Vitamin K2 takes the calcium out of your arteries, puts it back in your bones, so you get 2 bangs for your buck. And a thing called kyolic garlic helps pull the fat out of your arteries. So this nonsense about heavy dose of statin as much as you can give people, it's wrong, and it might work over a few years, but after 5 to 10 to 15 years you see problems. And finally, I'll just make one last comment, then I'll shut up. I do not prescribe fat-soluble statins. I think Lipitor and Zocor, so atorvastatin, simvastatin should not be on the market. I only prescribe water-soluble statins for people who need it. That's rosuvastatin and pravastatin because they don't get into the tissues. They don't cross the fatty membrane as much as atorvastatin and simvastatin.
Thank you. Please go ahead, Ursula.
What is very often forgotten is that sometimes cholesterol high cholesterol is coming from the liver. Not only it has an effect that the heart and the calcium score you need to measure, what I agree 100% with a colleague, but very often the liver gets forgotten. And if someone has, through different reasons, whatever, a fatty liver and some of the metabolic pathways in the liver are not functioning good enough, cholesterol gets higher as well. Yeah. Instead it's helping nothing, zero.
Yes. They'll only give side effects.
Exactly.
Yeah.
So always we have to watch out a little bit also at the other organs.
That's right, and that's what we're all talking about, that we're not a collection of parts, we're not like an automobile, we're actually an organism, and we all have to look at the organism, and I think every doctor on this panel will share the same view.
Just one quick anecdote. One of my patients went to see another cardiologist in Australia and said, I want to give you a statin. The cardiologist said, but doctor, what could this do to my liver? I don't care about your liver, I'm your cardiologist.
Well, there you go. So if anyone is concerned about their drug taking, especially about statins, if you can't see Dr. Walker, see a preventative cardiologist. The first word is very important, preventative. And that's the same thing that all of our doctors are doing. One thing that Dr. Mart talked about earlier with his patient was that he had a patient who came in with all those various conditions, and then finally he was described as having a panic disorder,
yes,
and he was given antidepressants.
Yes.
So Dr. Wessolly always says the best way to get depressed is take antidepressants. So I want to ask you and also Dr. Pataramongkolkarn the same question. When you find a patient who presents with what they think is depression, how can you help them in a functional way?
Mark first then.
Okay, so for the one that I think that he has the dysfunctions of something, the first thing is to rule out any organic cause first. That it means that it's not my duty, because if he has any problem about the disease, he visit the specialist first. Right. And after that, most of my patients doesn't have anything. They have a lot of evaluation and it's still within normal limit. But it means that it's not normal, but because they think that they are not healthy. Right. So I will focus, the first one, hormonal dysfunctions, and the second one is the gut dysfunctions, right, and the next will be the nutritional and lifestyle and also the supplement, and the next one is the heavy metal and detoxification.
Heavy metal.
Yes,
yeah,
that's
heavy
right.
metal detoxification. Yes, and we see a lot of heavy metal pollution in our bodies.
Yes.
Even if we prescribe to Dr. Patana's vegetarian regime, because a lot of vegetables are grown with pesticides, which have metals in them. So Dr. Patana, how would you treat someone coming in that presents with depression?
Well, just like Dr. March says, most of the times they have hormonal imbalance, and the most common cause of hormonal imbalance besides the aging is drugs. Okay, so a lot of people take statins. Statin take away cholesterol, and some people will start taking statin high dose, suddenly develop menopausal syndromes or andropausal syndrome and depressions. And also nowadays we have something that called estrogen, the fake estrogen things that we call hyperestrogen syndromes because of the food, the plastic city, and the plastic in our food, the insecticides, so we call estrogen disruptors, and that can cause hormone imbalance as well. Depressions can come from gut. Dr. Wessolly gonna talk about how guts affect your brains, and they can cause depression as well. So you need to treat your gut. Okay, and supplements can help. Okay, I use SAM-E, my favorite one, 5-HTP, GABA. That's where functional medicines come from. It means we try to correct our functions, dysfunctional cells, with some functional approach, not conventional medicine, which turn into dysfunctional medicine nowadays. The problems happen when people start taking antidepressants or sleeping pills. They will get hooked. They're addicted. It's so difficult. I just have the last patients who take lithium for 20 years. And he developed kidney failure, so I take him off lithium slowly. But it's so difficult. Eventually, he needs something, and I cannot control him with all the approach I'm talking about because he's hooked with the lithium, so I have to let him go to a psychiatrist. So when you start on drug, it's difficult to take you out of it.
Thanks, Dr. Patana. And Dr. Mark, I think the message is try and avoid going on these drugs in the first place. I have a good friend who's a psychiatrist in Vancouver, Canada. He's been practicing psychiatry for more than 40 years. And I asked him, Dr. Coolbeer, do you understand how these drugs you're giving to your patients work? And he said, after 40 years, I've got no idea. So he tries and works with his patients to do non-medical therapy, like meditation, nature walks, and nothing that's actually involving chemicals. But sometimes it's actually, you know, a lot of the patients want this pill to fix their problem, and they don't understand that it's probably going to be the start of other problems. So I think we're all on the same page when it comes to that. And Dr. Patana has just been talking about nutrition, Dr. Christopher, and I think you've been a big proponent about nutrition and eating the right foods. What would you say, you know, in 30 seconds or so, what foods would be best avoid to help maintain a healthy immune system?
First of all, I just want to comment on the psychiatrist that you spoke of, because a psychiatrist who's come over the line, because psychiatrists are really trained to focus on our mental health, but they're also trained to take that approach. The approach is medicine, and it sounds like your friend has come across and has seen the light. In terms of foods, I think the obvious, it's very clear, and you can just look around the world to what's happened from the 1970s when there was a large food surplus, and it's actually policy, health policy and government policy that created a lot of the problems in the production of corn syrup. And corn syrup is behind most of the problem that we now have in the world, which comes from fat. It comes from the chips and the crisps and the soda and the fast food and all of that we know is bad for us. Obviously, some component of fat is not bad for us, but having massive amounts of fat is very bad for us. So if we limit the amount of fat, we limit the amount of red meat that we eat, we increase the amount of green leafy vegetables, beautiful fruit, and we really capitalize on the learning of how not only we buy that food, how we source that food, where it comes from, that it hasn't been sprayed with all kinds of pesticides, and it's grown in a way that's sustainable. If we can do all of that, then we're doing a lot of good for our bodies. We're doing a lot of good for the world. We're doing a lot of good for the future of how we learn. And the earlier, again, I go back to education again. The earlier that we teach our young people how to do all this, the better. So the earlier we can get to them, the better.
Yes, it's something I think that should be taught in schools. So we've had a lot of education from the panel and from previous speakers, and we'll continue to have during the day. We've just got a couple more minutes on this panel, and I just thought we'd wrap up, Dr. Ursula, with your view on how medicine in Thailand is evolving in the functional way compared to what's happening in Germany, your home country, and which country is doing it right.
This is a good question. You know, one of the reasons why I'm happy to be here, and as well why I'm allowed to speak about a few things, is I know Dr. Wessolly since a long time, and we worked and collaborated since a long time together, and we both have the feeling that in Germany, where it was traditionally to work with natural substances, with secondary herbs and all of these things, it changed now politically. Pharmacies, whatever, is driving that. And in Thailand is a country where first this kind of medicine is traditional as well, and they have a very good base medicine for hundreds of years, what we understand better now, and what we will understand in the future much better. And I think in these countries, which are more, let's say, open-minded, when I can use this word, in the moment compared to Germany or other countries, we can develop new ideas, or also ideas based on science, and everybody of us is working on science. So we are not, as the first speaker already said, doing voodoo or whatever. So we're researching, we're looking what is working, and then we bring that to the clinical point. And I think Thailand is a country where we can do that, and where therapies are appreciated, where you use the body-owned system. In the case where I'm working with a lot is the blood of the patients, isolating specific cell fractions and train them to do their job or do a better job in the body. And these countries like Thailand are, I think, more open for that. Not only because I think medical tourism will increase, but also these options will be the future options. And at the end of the day, the thought, what I just said, is not a new thought. It's what we did years ago, but we forgot, because all of the chemicals, medications, all this was coming up, and we have to go back with a scientific background to that. And now the nice music is coming, so I have to stop.
Thank you, Dr. Ursula. Yes, the music is coming, and as Susie said, when the music starts, the dancing has to stop. So we've had a great discussion. Dr. Ross and Dr. Christopher, Dr. Ursula, Dr. Patana, Dr. Mark, we really very much thank you, and we really very much enjoyed Dr. Patton and Dr. Mark and Dr. Walker speaking earlier, and we're going to hear later in the day from Dr. Christopher and Dr. Ursula. Thank you so much.
Thank
you for
you.
educating us.
Thank you. Khop kun ka. Thank you so much to our respected panelists and also our moderator, Mr. David. Thank you so much for that thought-provoking conversation and, of course, directions on how we can all lead a better quality of life and some of the more precise approaches to healthcare, which can be done through functional medicine. We hear about nutrition, the guts, and, of course, exercising as well. And education, ladies and gentlemen, has been emphasized. Education is key to make people more aware, to be reminded as to how to lead a healthy life for long-term positive health impacts. Coming up next is another interesting topic of which I'm sure you all would like to hear. It's about gut health, the new era in medical spheres. As they say, our gut is our second brain. So we'll be hearing about this from our speaker. He is a highly sought-after speaker at specialist congresses and seminars, and he conducts training for fellow doctors in Germany and abroad. He's also a member of the German Society for Anti-Aging Medicine. So please warmly welcome our next speaker, Dr. Johannes Wessolly, anesthetist and integrative medicine from Ludwigsburg, Germany. He's here with us, ladies and gentlemen. A big round of applause, please.
So thank you very much for this friendly greeting and for inviting me to speak here. before I start with my presentation, I want to come back to a word we heard already, that is conventional medicine and the failures the conventional medicine makes. And so I want to tell you my own history. I started as a baby with a severe neurodermitis. When I was 6, in 1956, I had to go to school, and in a huge class with 56 boys, and there was one boy who got a summer flu, which was nothing else but a hay fever, but that was not known then. The word allergy was not known to the public then, and now nearly half of the children who go to school have an allergy. Then I was extremely hyperactive, so my parents put me into a boarding school with 10, and there I got migraine with 12. I had this migraine and other allergies, and then with 20 I got a colitis, an ulcerous colitis, which was treated with cortisone and immune suppressants. And when I was 50, I found out that I had a food intolerance and nothing else. Milk, gluten, eggs. I did a diet for 6 weeks and everything was gone. And that is the reason why I'm here today, because that changed my life and my medical life. I used to be an anesthetist, and that was the start for functional medicine, because I thought if my history cannot be, I cannot be the only one who has the same histories. And I found them, thousands. And that is why I'm so convinced that we have to take care more of the gut and the gut microbiome, because that keeps us healthy. And that is, of course, when we are talking about anti-aging, we are talking about this billion-dollar dream of stopping aging or even reversing aging. Well, maybe that comes in the future, but today we can at least provide healthy aging. And you will agree with me that healthy aging is not possible with a good brain health. And so I want to show you why it is so important to keep the brain healthy by checking the gut. So already 100 years ago, a German naturopath said Bauchhirn, that means gut-brain. And that is true, because we have more nerve ends in the gut than in the brain. Brain and gut communicate closely. Messenger are, we know them all, serotonin, dopamine, melatonin, but the gut bacteria produce a lot of vitamins, a lot of micronutrients, but also short-chain fatty acids. And that is the most important part for the brain. Stress and depression are gut feelings, and depression depends on a healthy gut also. So the diversity of the intestinal flora decreases in old age. And why? Of course, altered hormone production in the elderly, and medication. Tons of different drugs. The food in the homes for elderly people is bad many times, but never missing are the tons of drugs they get. And I can tell you an example of a patient of mine, 86 years old. His son brought him to my clinic because he was falling all the time when he was getting up in the morning. And then I checked his medication. And he had 3 pills against high blood pressure, statins, proton pump blocker that made him feel vomit. Then he got metoclopramide, so that made him dizzy, and so he fell every morning. And they said, oh, we have to bring him into a home for dementia. And then I took away everything he got, everything. And gave him 2 infusions with micronutrients, gave him some supplements, and he woke up. He was completely normal. he could go every night. He went to his pub. He was a wine grower and had his couple of glasses of wine. And after 4 years, they had prepared the party for his 90th birthday. And he came back late at night, had drunk too much, fell down in the staircase and broke his neck. Okay, what a way to go for a wine grower. And what is most important is the altered eating habits, one-sided diets. Old people eat preferably carbohydrates because they can taste the sweet very long, but not other tastes that depend on the nose. But they can always feel the sugar, the sweet in their mouth. And, of course, the reduced detoxification in the liver and the kidneys. These people get their drugs for 30 years without checking it again. And so, of course, they have slowly, they have an overdose of everything. And that makes the situation really bad. So, diversity, what does it mean? Normally we have more than 1,000 strains of bacteria in our gut, and they communicate with each other, they feed each other, they protect each other. And if we don't have that due to the drugs, due to our food, then we have problems. Here on the right side, you see these short-chain fatty acids. The production goes down, but that one, interesting for the TMHO, interesting for the cardiologist, goes up only because of the gut flora. And we have cardiovascular diseases, in gut inflammation. And inflammation, that is the problem also for the brain. And vice versa, if the diversity is high, then we can reverse all that. So how does the intestinal microbiome age? There's a change to these proteobacteria. And we see that here, this part is getting bigger and bigger, this proteobacteria, and with all these pathogens in there. The bifidobacteria and other good bacteria go down. So when we speak about brain health, we have to look into the brain and see the cells which are there. And that is the glial cells. They hatch and protect the neurons. And I want to speak about the microglia. That is most important. And its food, the butyrate. These SCFAs, they protect the maturation of the microglia. So what is that? That is a kind of an intrinsic immune system. They behave like macrophages. They metabolize cell detritus, misfolded proteins, bacteria, amyloid, toxins, and most important, they can produce also pro-inflammatory cytokines. And like other immune cells, there are different phenotypes. We focus here on the right side, this M1 classical activation. In that case, if there is a stimulus, this microglia produces these pro-inflammatory cytokines and can encourage other glial cells to do the same. We see here on this side a couple of drugs that can reduce inflammation. And here we see the serotonin reuptake blockers. If these drugs have any action at all, it's the anti-inflammatory part and not the serotonin reuptake. That is nonsense. We cannot influence the serotonin metabolism by SSRIs. So here we see that what happens with the microglia under stress and inflammation. Normally, these microglia is resting, waiting for any signals and balancing the inflammation. But if it's constantly activated, and that can start in the womb as an embryo already, then they will go into a chronic inflammation, and that is aging. Aging is inflammation. Dementia is inflammation. And so if the mother has a lot of stress during pregnancy, the person will later develop a depression much easier because these microglia can be activated too much and very easily. So, and what has that to do with the microbiome? That is an article from Neuroscience from 2015, already old stuff. Host microbiota constantly control maturation and function of microglia in the CNS. That is well known. So, the production of butyrate in the gut is most important. That is the food for the microglia, and that is the stuff the microglia needs to establish the inflammation homeostasis in the brain. And if this butyrate is not there, then we get a problem. We see that here again, but in contrast, recolonization with the complex microbiota is partially restores the microglia in the brain. And that is why we have to watch the gut microbiome much better than we did that before. There are still doctors who don't accept that. In the clinics in Germany, some of my patients who ask the doctors, should I take some probiotics? They got the answer, yeah, if you want to burn your money, and then you can do that. So, well, the leaky gut, leaky brain. If you have a leaky gut, that is a similar action like in the leaky brain. We have these tight junctions in the in the gut. We know that, but we have that also here in the blood-brain barrier, and that is the blood side. That is the brain side, and we have as a part of the blood-brain barrier, we have these astrocytes. They protect this part, but if we have here a leaky gut, and there are molecules, pro-inflammatory molecules coming to this place, they don't have to penetrate into the brain to create an inflammation. It's a kind of signaling, and that makes it so important to avoid this leaky brain, this leaky blood-brain barrier. These short-chain fatty acids have to be produced in the gut, nowhere else. And only about 20% of all these bacteria can do that. And most important bacteria for butyrate is Fecalibacterium prausnitzii. And it's most of the times it's extremely reduced in people with dementia. So it was, in my mother, I checked her gut microbiome with, when she was 98, and it was exactly like that. So that is an example of a person who had a bipolar disorder and was under lithium also other drugs. And you can see here, that's only a little section from our PCR stool tests. You can see here that there's no butyrate building bacteria at all. And of course, we can also see that we have a signs for inflammation, but no butyric acid, no propionate, but a lot of inflammation. alpha-1 antitrypsin, high calprotectin. That is a very important inflammatory marker. That one can cause inflammation in the brain without going there, just docking on this leaking part of the blood-brain barrier. So, what are we doing? We're giving the same thing we are giving cancer in other inflammations like curcuma, resveratrol, boswellia, and most important also vitamin D, and of course short-chain fatty acid. We can give that also as a drug. The take-home message: the intestinal flora influences the function of the brain via blood-brain barrier, and dysbiosis in the gut causes behavioral disorders, accelerated progression of Alzheimer and dementia. But the present studies show that even in humans, that can be reversed by probiotics. And we can even show that in brain scans. That is a brain scan after 4 weeks of a certain probiotic, and that could show that in these green and blue areas, the activity was better only after 4 weeks of probiotics. So, but how can we get good probiotics or good gut bacteria? Well, that is the version. That is the version for men, and that's the version for children. So let children play wherever they want. They can eat dirt or rainworms or whatever. That will make them stronger. If you are not living beside a farm, we have the solution. Also, we have multi-strain bacteria or mixtures, and that is one is already for dogs, and one is for little babies. I give all the little babies probiotics right away after birth. And so we have for different indication, we have probiotics. I'm taking probiotics every day for years already. So, and because I hate this music, I will stop now. And thank you for your attention.
Thank you very much, Dr. Wessolly. And listening to what Doctor has said, health gut is absolutely important. There's a link between the gut, the immune system, the mood, and the brain health. So, ladies and gentlemen, it's time to take care of your gut, find harmony with your gut. Thank you so much. So moving along to our next topic, it's about how functional medicine is driving change in cancer care. Now, this will be presented by two speakers, Dr. Emon, Pataramongkolkarn, Integrative Medicine Cancer Specialist from Bangkok, Thailand, and Dr. Olan, Piamkulvanich, founder of Wessolly Research, also from Bangkok, Thailand. So let's first hear from Dr. Emon, Pataramongkolkarn. Dr. Emon is certified by the Board of Anti-Aging Medicine from the World Society of Anti-Aging Medicine and is continuing her advancement in this field. She is currently studying MSc in Integrative Medicine and Wellness. Ladies and gentlemen, please put your hands for Dr. Emon.
Sawadee ka. Can everybody hear me? Yes. Good afternoon, everyone. So now it's like noon time already. So today it's gonna be a little bit late for you to have lunch, okay? But just please listen to our lecture first. So today is gonna be how functional medicine is driving change in cancer care. Right now, everybody know that like nowadays, cancer become our global crisis. You know, from the WHO 2020. We know that nearly every year we have new cases of cancer, more than nearly 20 million people every year. And people also die from cancer 10 million every year as well. The most top 5 of the cancer, as you can see from the slides, breast cancer, lung cancer, colon cancer, prostate cancer, skin cancer, you know. And it's like nearly everyone, 1 in 3 people in our lifetime, we can have cancer. So that is a very big event. Not only cardiovascular problem, not only kidney problem, but cancer as well. So as Dr. Ma said in this morning lecture, how functional medicine can approach for cancer care. As you can see from the slide, functional medicine, we not only treat the symptoms, we don't only treat the diseases, but we want to know the root cause of the disease. As you can see from here, you have many kinds of diseases, but maybe the root cause are the same or very, very similar. But again, everyone is different. Every cancer cell are also different. So maybe here, it can be hormone problems, it can be mitochondria problem, it can be immune problem, it can be detoxification problem. So anything can cause cancer, but we need to know why and how we can treat those patients. So now this one is not a new idea. So this one is from the Metabolic Approach of Cancer book from 2017. So they have summarized the big key things for cancer care. First, we talk about genetics, we talk about epigenetics. So not only your genetic can cause cancer, that only give you the risk, but the main thing is your epigenetic as well. So epigenetic is everything around your body, your pollution, your food. Every doctor talk about this, but we're still not getting there yet. Second thing, as Dr. Pataramongkolkarn said this morning, sugar. Sugar is toxin, and sugar is very important for cancer cells as well, because everybody know cancer eating on sugar. So if you have the 5, white carbohydrate, you know that you can have a higher risk of inflammation and cancer too. 3, again, toxic burden. If you cannot deal with your toxic inside your body, now today we live in the city center, like in Bangkok over here. So it's very easy that you get PM 2.5, you get heavy metal for the air that you breathe in. So it's very easy to down your immunities. Fourth thing, number 4 and number 5 is the today's topic that I would like to emphasize on. So again, as Dr. Wessolly says before, about our microbiome. But not only our gut, our microbiome is everywhere, in our eyes, in our skin, in our gut, it's nearly everywhere. So that's super important. Number 5, immune system. Cancer is very special. They have their own ways how to deal with our immunities. Even though you have a great immune, you check your blood test, everything is great, but why patients still have cancer at the end? 6, again, inflammation. Now today, everything can cause inflammation. Your food, poor lifestyle, bad sleep, then again, bad inflammation. 7, if we can deal with the food and how can cause your exercise better, but circulation better, but we need to stop the cancer to spread around the patient body, how we can do with that. Number 8, hormone balance. Again, come back to the hormones. Everybody need a good hormone, as is our basic thing, our foundation. If you don't have good hormone, you don't have a good life. Number 9, again, stress level. Come back to stress, come back to your biorhythm. So we come back to this one later. And the last one, but very important again, our emotion. Everybody knows we have 10 things for hallmark of cancer. But this year, they add 4 new things for cancer. They add unlocking phenotype of plasticity, about epigenetics, senescent cell that we know for a long time, and the last one that's very important, about the microbiome. As we can see from here, as I say, that obviously said about gut microbiome before, but as I told you, microbiome is not only inside your gut, it's inside your lung, it's inside your skin, inside even the tumor environment as well. So in here, the microbiome is a big key for the growth of the cancer cell, the inflammation of cancer cell, how they make cancer cell invade from your immunities, and how you make your cancer cell become more genetic mutation. And of course, the microbiome is also a big player that make our therapy is not successful. Or basically, we can say cancer patient, why we need to change the chemotherapy every time, why we need to do the immunotherapy, because they have their own ways. So the microbiome is very important over here. Because first, as I told you, it can promote the tumor growth. It change many things of tumor microenvironment. And the very bad thing, the microbiomes everything that we give our patient in a conventional way, for example, chemotherapy, antibiotics, steroid, everything can impact patient microbiomes. So this kind of impact can also impact patient immunities and also impact the way that we can treat the patient. And we have so many research over here. This is the last year published paper about like breast cancer patient and their like microbiome. We can see from here that like if the patient had bad gut microbiomes, it can affect their first, like aging problem, genetic problems, chemotherapy problem, immunotherapy. Everything that is can affect from microbiome as well. Next topics I would like to emphasize about the cancer and the immune system. As you can see in here, it's a breast cancer cell, but surrounding of the cancer cells, there's so many things going on. All like, red blood cell there, immune cells, so many immune cells, and so many signaling around outside the cancer cell. What's going on with them? Next hallmark that I would like to emphasize is avoiding immune destruction. As you know, like cancer patients, some of the patients who never go to chemotherapy yet, they still have kind of like good number of like the white blood cell, but why it's not function good? Because the cancer cell, they have some kind of a special gift that they can avoid about immunities. So that's why, like 4 years ago, there's a new Nobel Prize that give about immune checkpoint inhibitors. Now today, we patient has a high survival chance to live longer because we come up with this kind of immunotherapy, or we call immune checkpoint inhibitors. So I would like to wrap up everything for this part about the cancer and the immune system, how we can maximize and personalize, our cancer therapy. First of all, as all the doctors say again, elimination of inflammation of food. For example, food intolerance, you can do all intermittent fasting, gut repair, and of course, good strain of probiotics that's very fit for your patient. Second thing, therapeutic food and functional food, all micronutrients, all about microbiomes, good fat, vitamin A, vitamin D, etc. Number 3, again, about the immune system, you need good mushroom. We have many special kind of mushroom in Thailand, and there's so many research about that, and we know that this one are very good. Number 4, anything that can help patient with anti-inflammation, fish oil, vitamin D, curcumin, CBD. If it's gonna be legalized next month, it's gonna be great. Many things, melatonin too, it's very good, like antioxidant. Number 5, immune modulation. They have mistletoe for long time period of therapy, GC-MAP, Sadacin. Number 6, of course, sometimes the patient, they cannot eat and absorb the good food that great. So we need another kind of therapy for the patient. You can give patient vitamin C, for example. You can get infusion curcumin. You can give resveratrol and quercetin. This is gonna help patient a lot because we need to understand sometimes the patient, they have leaky gut, leaky brain, as Dr. Wessolly said before. So sometimes the infusion is the best option for the patient, but not for everyone. Next thing is adequate sleep, good sleep quality, very important. As good sleep, have good melatonin level, good antioxidant again. 8, movement exercise. Everybody say you need to have the good muscle, and good muscle create good immunity as well. So that's why it's go along together. Next one, detoxification, stress management. Of course, the last one that I just emphasized about the immunotherapy. So every patient is different. So one patient may have problem with NK cell, one patient might have problem with their, immune checkpoint inhibitors. So that's why we need to keep the patient immune system in balance. And because next speaker gonna be Dr. Olan, so I will finish my lecture today. Thank you so much.
Dr. Emon for the presentation. All right, we got an idea of cancer care and, of course, how functional medicine can help come into play to prevent the disease. And as you are aware, our next speaker is Dr. Olan Piamkulvanich. Dr. Olan graduated from the Faculty of Medicine at Sirirat Hospital, Mahidol University, and continued his diversifying knowledge in oncology and immunology with therapies for chronic inflammation, autoimmunity, and allergy. He is also American Board Certified in Nutrition Wellness, and he's here with us on stage. How about a warm welcome, please, ladies and gentlemen, Dr. Olan.
Okay, good afternoon, everybody. Okay, thank you for Dr. Emmy. She introduced some for cancer microenvironment already. That I will talk for deep in our immune cell. Okay, I think Dr. Emmy told already for the last 10 years that the world excited for the new treatment, checkpoint inhibitor. And in that time, we can improve the survival and the cancer treatment better. But cancer environment, microenvironment is have more, that cancer do many things. Not only secrete the checkpoint and make the immune cell exhausted, but the cancer cell do like they can down-regulate the antigen presenting by down-regulate MSC class 1 molecule, and it secrete many cytokines to suppress our immune cell. Then that the problem that how we can solve in other problem, that today we will talk about how we can do. Today we would like to introduce you for the immune cell we call NK cell. Why we talk about the NK cell? Because for me, I have experience for NK cell in the long time. And I know this cell is have a powerful and is important in the frontline defender for the many infection and the cancer. NK cell have a character by it's developed from lymphoid progenitor cell. It's same like a T cell, B cell origin, but it have a large granule that contain the enzyme that they can destroy the foreign cell. And we can find NK cell in our blood circulation around 10 to 15% of lymphocyte number. We can divide NK cell into subset. One we call cytotoxic NK cell. This kind of NK cell is have more cytotoxic activity. That means it can destroy the foreign cell immediately. And another NK cell we call regulatory NK cell. Normally in each organ, our organ, these two kinds of NK cell is not same level, same percent. Example, in our blood circulation, we have a more cytotoxic NK cell, around 90%. And we have regulatory NK cell around 10%. But in our uterus, it's changed in this proportion. In uterus, we have more regulatory NK cell. It's around 70% and less cytotoxic. Why? Because I have some patients that have unknown cause of repeat miscarriage. That we found many cases have a high NK activity. That means if some thing happen in the uterus and NK cell activated. And that means sometimes it have a problem. Okay, NK cell have a unique recognize to the foreign cell by it can detect the foreign cell by non-MSC restrict. That different from other cell like a T cell or other cell that must detect the foreign cell by detect the MSC receptor. And it can secrete interferon and other cytokine that activate the autoimmune cell. This is very important because NK cell is highest secret interferon. And we know in the COVID-19, the one problem of severity is depend on the interferon in the early stage. Because have many papers show we can detect the severe case that have autoantibody for interferon. That the big problem for viral clearance in the early stage. The function of NK cell that very unique because it have their own receptor by they control by balance of activating and inhibitory receptor. Example, when they found a foreign cell like a virus or viral infected cell or cancer cell, some that cell will down-regulate the MSC class 1. That means autoimmune cell like a T cell cannot detect it. But NK cell is have a activating receptor that can detect the ligand, like a straight ligand that have present in many kind of cancer cell and senescent cell or viral infected cell. That's how NK cell work. Okay, this in our lab, we show the video for how the NK cell destroy the cancer cell. The green one is leukemia cell, and NK cell we cannot see, but I will show you. Wait. Okay. Okay, I think it has some problem. Okay. Normally, NK cell is stay like a group, but you cannot see that cell, but you can see the cancer cell when they made the NK cell, the color, the fluorescent color disappear. That means NK cell can detect it and destroy it. This method we call NK activity assay that we doing now. We have the level of the healthy people of NK activity. For male is 43 to 58% and female 35 to 51%. This is very important because from our experience and many papers show if you have a lower level of NK activity than this one, it have a risk to have a more cancer incident rate around 2 times when we compare with normal people. Have some disease we call NK deficiency that are from genetic alteration. We will find that this patient have a very low level of NK activity, and that patient have the problem, many diseases in infection, viral infection, fungus, and cancer. How we activate the NK cell? Our lab, we can activate by correct blood, the patient blood, and we stimulate and activate the number and the activity of NK cell. Okay, many cancer I think you know already, is have many clinical paper for NK cell treatment. We have a paper in Thailand already. Okay, we can conclude. Okay, the last one, I would like to tell everybody we should take care the micronutrient that many micronutrient important and affect to the NK cell, like vitamin A, B, C, or selenium, vitamin D. Okay, that all already. Thank you, everybody. Okay.
Thank you so much, Dr. Olan. Ladies and gentlemen, and that was how functional medicine is driving change in cancer care. Moving on to our next topic, still about cancer, but now it's going to focus on functional approach to cancer care with precision medicine. We have 4 speakers for this session. I'd like to introduce you to our panelists, Dr. Johannes Wessolly. We met him earlier. He joins us once again in this conversation. Dr. Wessolly has refined his approach over 20 years of successful medical therapies, implementing a practice known as integrated functional medicine, a method of treating patients gaining broad-based acceptance globally. So it'll be great to have him here to share his perspectives. And also coming back to the session is Dr. Emon, Pataramongkolkarn, integrative medicine cancer specialist from Bangkok, Thailand. And Dr. Emon has trained with Dr. Wessolly in Germany and deepened her medical experience in anti-aging and regenerative medicine with further study at Turkit Bandit University. And then we're also very pleased to have with us Dr. Bert Stephan, personalized cancer diagnostic scientist from Hamburg, Germany. Dr. Stephan is a German researcher and scientist who has dedicated his career to personalizing medicine through diagnosis. He is a CEO of Metavectum, Institute of Oncomolecular Diagnostics from Hamburg, Germany. And last but not least, joining us as speaker is Dr. Thirajet Sukhsuperm, oncologist from Bangkok, Thailand. Dr. Thirajet is a specialist in integrative oncology. As a cancer specialist, he uses a combination of cytotoxic and targeted drugs, immunological therapy, and high-intensity ultrasound treatment to control cancer while maintaining quality of life. And standing by on the stage, ladies and gentlemen, is our moderator for the session, Mr. David Bohm. So how about a big round of applause to welcome our speaker and moderator for the session.
Hello again. We have a very balanced team of cancer treating doctors here, 2 from Thailand and 2 from Germany. So I think we're going to have a great session. And I have to let you know that if I or anyone in my family or close friends came down, unfortunately, with cancer, then the only team that I think I would need would be with these 4 doctors. So it's very great to have everybody here and with such expertise. And fortunately, most Thai people have nicknames. So we'll use the nicknames for our Thai friends, Dr. Yam and Dr. Emmy, if you don't mind. It makes it much easier for me.
Of course, yeah.
So first of all, it's really important if someone is diagnosed with cancer to understand what cancer they have, because I now know that there's as many cancers in the world as there are people with cancer. There's no one disease called cancer. It's a disease that is as many people, as I mentioned, that has cancer. So the most important thing when you start the cancer journey is to find out what kind of cancer you have. and what kind of cancer, how it can be treated. And we have a very close colleague and partner in this cancer journey, Dr. Bert Stephan from Medavectum in Hamburg in Germany. And Dr. Stephan and Dr. Wessolly have been working together many, many years in the diagnose and treatment of cancer. So, Dr. Stephan, if we could start this cancer discussion, please, with Medavectum and how Medavectum helps the patients to understand the kind of cancer they have and how it should be treated.
My co-workers and I run a company, a small company in Hamburg on the DAISY side. DAISY is an abbreviation for German, is a very big German research facility. And we try to shed a little light on the origin, the aggressiveness of cancer, and especially on the metabolic roadmap. And from these data, we try to derive a therapy proposal which will be discussed with oncologists and with the treating doctors. For us, I must a little bit insist, it's not of interest the type of cancer because we are looking in the roadmap of cancer. For instance, if 3 patients suffers from stomach cancer, you have 3 different types of stomach cancer, which were treated in the past due to guidelines in the same way. And the fate is then very different. And therefore, our approach is more or less personalized or individualized and only target-oriented. For instance, in former times, people differentiate between lung cancer, prostate cancer, stomach cancer, and so on. But we see that a lot of markers which are in the past more or less responsible for or in connection with stomach cancer, that one finds these markers also in lung or in liver cancer. And therefore our approach is more a general one, deciphering the metabolic roadmap of cancer and then derive a therapy proposal.
Thank you, Dr. Stephan. So I think the clear message here is that the Medavectum diagnostic test not just shows the patient and the doctor the kind of cancer, but also the way to treat the cancer. So between Dr. Wessolly and Dr. Emmy and Dr. Yam, they will use an integrated approach when it comes to the treatment, using the guidelines established by the Medavectum test for that individual patient. So, Dr. Yam, I'd love to hear, the audience would love to hear from you.
Yes.
And we'll hear Dr. Emmy as well, because you work very closely together. When you see the results in the Medavectum test, and we usually need both conventional and complementary medicine, how do they work together? How do we use the chemotherapy and the radiation together with all the types of things that Dr. Emmy mentioned in her presentation?
Yes, the approach in our center, we look at the cancer as a biological change in our body. It comes from 2 parts. The first is came from the genetic change in cancer cell, and the second it is the defect in our immune, which cannot eliminate this kind of abnormal cell out of the body. So we divide this kind of the biological change into many groups because we know each one are not the same. We are different by gene. Even cancer in the same patient time by time, the first treatment, third treatment, fifth treatment is different. So the first step, we approach how aggressive of that cancer. In the case that is very aggressive, we combine all together to the patient, but our concept is we weigh between the benefit and the side effect. So we use this kind of test like a Medavectum test. It is a kind of blood test. In your blood, in the blood of cancer patient, there is a cancer cell circulating. We have technology to capture that cancer cell, so we can make sure that it is cancer cell, the first thing. But we do not the qualitative test, we do the quantitative test. We can measure how many of the cancer cell. The much more cancer cell means the more aggressive. Then we use the profile, because in the Medavectum we match the genetic characters of the response, non-response of our drugs We mean chemotherapy, immunotherapy, and then the targeted therapy. We pick up the profile of the patient of the drug and match together. But if we cannot capture the response characters of the conventional drug, what we do? We study a lot in the cellular biology of cancer. Then we know some kind of gene or cell pathway, we can stop it to stop the cancer for growth. Some kind of this chemical not yet got FDA approval, but we have tons of medical research in PubMed database. It is like you may have heard about the role of vitamin C, the role of hyperthermia, the role of some old drug that we repurpose like quinine and like COX-2 inhibitors and many. But we don't try random. We use the data. Right. So it is like we are the team of data scientists, right. Yes, or the basic researcher, clinician, and supporter. I give the weight of the supporter to up to 50% because by my practice I prescribe chemotherapy. I know this chemotherapy is response because we met the gene character, but sometimes this kind of drug causes side effect. The failure of treatment didn't came from the drug, but came from we cannot improve the patient's body health to cope with the drug side effect. Dr. Amy helped me a lot in many ways, the nutrition, the rehabilitation, and many, because we are working team. So if you want to win the war with cancer, you could not fight separately. Like when we make a war, you have to combine the air power, land power, and marine power all together.
Integrated approach, exactly, Dr. Yam.
Yes, exactly.
So then, carrying on from that, Dr. Amy, Dr. Yam is an oncologist, of course, and he administers, when necessary, the chemotherapy. How do your therapies that you and Dr. Wessolly have worked on help the patient keep strong and keep their immune system, as you mentioned in your talk, balanced so that they can, their own body is helping the journey to fight the cancer?
Yes, because as the patient has cancer in their body already, we know that's something wrong. And if you just completely bombard them with chemotherapy, targeted therapy, or even radiation, it's gonna be too much for their body. And we can even weaken their immune system, gut microbiome, and everything. So that's why so many cancer patients, they has bad side effects from the conventional therapy. So when the patient come to see us, first of all, as all our doctors say, we need to evaluate the patient first. So we need to see that the patient mind and body ready for those kind of therapy or not. We know exactly from the lab test what kind of chemotherapy, targeted therapy that the patient need to get. But before we're gonna go to that one, we also need to see patient immune system first, like NK cell, as Dr. Olan say, how it's good or not. All the micronutrients, vitamin, minerals are good or not, and especially patient stress, mind and body, they are in good function or not. So at all these steps, we need to keep the patient in good shape before we administer any kind of conventional therapy. And of course, not only before and after, but in between as well. So that's why we need to have a plan for each patient, individualized or personalized therapy before, between, and after, how we can prepare the patient. And we not only work by one doctor, we work as a team, scientist team, doctor team, oncologist team, integrative team, physiotherapist team, nutritionist, As the patient needs many things together, we treat the patient as a person, holistic thing. We not treat the cancer itself, but we treat the patient.
Yes, thank you, Dr. Amy. And that's exactly what Dr. Wessolly always says, that as a practice, we don't treat tumours. We treat people with tumours. So I think that's a clear distinction. And I think it's very important to hear from our medical director, Dr. Wessolly, who actually started his practice in Germany 20 years ago as a preventative practice. It became more of a curative practice, but he loves prevention. Dr. Wessolly, it's better if we don't get cancer. So what can you share with the audiences, your suggestions as to how to minimize the possibility of getting cancer, given that some of us have the genes which have a possibility of greater likelihood than others?
Yeah, of course, that is a very good remark. We don't treat cancer, we treat patients with cancer. And I started the whole thing, I would never, had never the intention to treat patients with cancer, but so many people came after therapy and said, can you do something for me well, I'm feeling like nothing, I'm weak, I have pain and I cannot eat, the hair is falling out, and then I started with repairing the damages by the chemotherapy. And slowly people came and said, oh, can you also do, I have cancer, I don't want the conventional therapy, can do something for me. And then I started to work together with Dr. Stefan, because I saw that many times the chemotherapy or conventional therapy is a kind of a statistical therapy. Let's say a drug works in stomach cancer like in 70% of the people, but what happens to the 30% which are not reacting on this therapy? And and these poor people, they are in a worse condition after the chemotherapy than they were before, because their immune system is gone, the microbiome is gone, and so the mitochondria are damaged. With some chemotherapies, the heart is damaged, and so we started to see what is really helping the patient and find out that, because everybody has its own cancer. And that is very individual. Prostate cancer means in each individual something different. There are small changes in the metabolic pathway with make the cancer grow, and that is why we combine now all these methods. We look for conventional, of course, but we try to avoid the ones which are not helping, and that we can see that. And we can even see that one of the first-line chemotherapies are making the tumors more aggressive. We can see that also and avoid that. And that is what we call individualized cancer therapy. And of course, we take care of the nutrition, of the gut, and of the psyche is also very important. If people were told, well, you have to live 6 months, then they die after 6 months. We have to encourage them that they are able to fight, and they make them, it sounds funny, but make them happy.
Yeah, and I think if you're told that you only have 6 months to live, I don't think the doctor actually knows that. You know, it's just based on
statistics,
a guess, right?
Yeah, of course.
Yeah. So, and following on from that, Dr. Emmy, you mentioned that in your talk that in treating of cancer, we need to avoid immune dysfunction.
Yeah.
And I thought that was very interesting, and perhaps yourself and Dr. Yam could explain that a little bit more.
Yes.
How do we avoid immune dysfunction when we're being treated for cancer?
Yes, in our center, we approach body's immune function in the 3 pillars. The first, generally, immunity, we divide into steps. The first, immune cells have to notice, is there any cancer in our body? And the second, they have to decide how to destroy that cancer. This is the first part. The second part is come after we imply any immunotherapy. But when we imply immunotherapy, some patient respond or not respond. Now, due to we have a lot of basic science, some of the mechanism we know why cancer not respond is about the immune break. So for the treatment, we divide into 3 groups of treatment. The first we start from checking the immune system. We check for the numbers and the quality of function. So the first step, we enhance the immune cell function called enhancement, not about the number. But if you have low the numbers, very low the numbers of immune cell, we have the technology like NK cell treatment, like DC cell treatment, cooperating by the laboratory of Dr. Olan to work together to make your immune cell increase in number. But most of all, it is like when you see in many wars, sometimes the attackers has more soldiers, more weapons than the defender. Why the defender can stay stronghold? Because they can break the attack of the cancer cell. So the immune break is the groundbreaking Nobel Prize innovation. Due to we know that some people, their cancer cell can break the immune system. Why? You may have heard that in our bodies we have the disease called autoimmune disease. Usually our body have the structure like an immune brake to stop immune to kill cell. So when we have the normal cell change to cancer, it still carry this immune brake. So this kind of immune brake, now we can check, we call the PD-1, we call the CTLA. So we can decide what is the structures of the protein in this immune. We can decide what is the structures of the protein to inhibit, to release the brake. When we release the brake, your immune can kill cancer. So the third anti-immune braking, we may call the checkpoint inhibitor. This is the world standard new kind of cancer treatment. When we do this approach, sometimes we can ignore the chemotherapy. In many conventional treatment standard guidelines from the US and the European, we have the data that start with immunotherapy, yield the better response, long-lasting response with less side effect. This is why we combine all of these together.
Right, Dr. Emmy?
Yes, and like as Dr. Yam also mentioned about immunotherapy already, I also would like to mention the other part as well, because like we need to understand like the patient after certain kind of like, you know, chemotherapy or like radiation, we know that patient like get a lot of inflammation inside their body. When you have a lot of inflammation, high inflammation level, your immune become exhausted. So exhausted your immunities, of course, they're not gonna work that great. So right now in Germany, we have a new technology to check our immune system. Like for example, your NK cell is low already, low in number. How are we gonna make it better? How are we gonna make the function greater? So sometimes only like the common food, you know, like vitamin D3 can enhance your immune system already. Or something like the good of mushroom, like shiitake mushroom, whatever mushroom, the mushroom can help you as well. So that's why like if we can treat the patient, you know, with functional food that's personalized for that patient, of course the patient immune system will be better for sure. And not only the food, of course, like as Dr. Wessolly mentioned before, our patient gut as well. When you get like chemotherapy, when the patient get like antibiotics or basic stuff or conventional medicine, the patient gut get destroyed. So we need to repair the gut. We need to make the gut like stronger, you know, good probiotics, great probiotic in their food, and those stuff will rebuild the patient immune system again. And not only those stuff that we mentioned, the basic ones, something like stress management, you know, encouragement, those are very super important for the patient too.
Thank you, Dr. Emmy and Dr. Yam. I think it's very important also to understand that when you have a cancer treatment and you are told by a doctor, oh, you're cured from cancer, I don't think that's actually true, because all of us have cancer in our bodies every day. So it's very important once you've been treated for cancer that you are followed up and you monitor the situation in your body going forward. And Dr. Stefan was telling me about a very important type of regulation for cancer patients called RECIST protocols. So Dr. Stefan, if you maybe could tell the audience a little bit about that and how important it is in the ongoing treatment of cancer.
I think these RECIST criteria are very important, and it gives more or less the status of the patient for a longer time. And the doctors and also statistics can get information. Was this treatment successful? How about life quality? And what may be the future of this patient? Unfortunately, especially in Germany, after treatment, maybe with carboplatins, then they see that the tumor is shrinking. The doctors release the patient and see you in 2 or 3 years. And there's no monitoring, nothing. But then the patient mostly run into a catastrophe, especially if he suffers from a very aggressive cancer, because cancer is a very tricky organism which very easily responds to the treatment, and it is like playing chess, and you have to react very fast to your enemy, and that means you need a constant monitoring, after treatment or during treatment. This is on the one side the so-called racist criteria, but on the other side it's more or less possible to have PET-CT scans and MRTs to see how the therapy proposal may be go to a successful end for the patient in terms of treatment.
Thank you, Dr. Stefan, and I think it's just absolutely important that for any people who've been treated for cancer or any loved ones that they continue to follow up, going to see the medical practitioner just to monitor the body and make sure that nothing's changing to adversely affect the impact of the cancer in the body. So I think that it's also critically important that people understand the nutrition, and Dr. Emmy mentioned that in her talk, and I know Dr. Wessolly has spent a lot of time studying nutrition, especially for people suffering from cancer. So in your experience, Dr. Wessolly, because I hear a lot of cancer patients saying to me, they ask their doctor, their oncologist, well, what can I eat? And they say, whatever you want. I don't believe that's actually true. So Dr. Wessolly, what is the right diet to have for someone who's being treated for cancer?
Well, in general, you can say that low-carb diet or no-carb diet is in most of the cancers the right thing to do, not in all of them. And so that is why we focus, but we can find out by checking certain genes if the cancer is in this metabolic situation that it relies exclusively on glucose. And of course we can do a lot about that. We can also combine it with a therapy like we give to diabetic patients. And that is what I would in general recommend. So that is, but can I speak about something else also? Because Dr. Pataramongkolkarn is here and he mentioned, I know that he is a friend of hormones. And maybe that is now a little bit for some provocation, because most of my patients have either breast cancer or prostate cancer. And the ongoing therapy is to take away all the hormones from these patients, and that they are suffering like hell from this hormone deprivation. And I'm quite sure that we are not doing that anymore in 5 years. I hope so. What do you think? Yeah, we can speak later. You're not here. Yeah, and that is because that is really when they give men this total deprivation of hormones. They don't die from the tumor, but from a heart attack 2 years later. But that is not the problem of the oncologist. That is the problem of the cardiologist. And so I think I met a urologist, a very progressive urologist. He said only 3 weeks ago, he said we will treat people with prostate cancer with testosterone in the future. And the same thing, like Dr. Hertoge from Brussels, he gave his wife estrogen in a in a receptor-positive, estrogen receptor-positive cancer 10 years ago. She's very well. And because that is really a problem, the side effects by this deprivation of the hormones. That is aging in a very fast way.
And Dr. Wessolly, what causes that deprivation of the hormones? What in the treatment causes that to happen? For those of us who are not medically trained. So why do the patients have that hormone deficiency?
Yeah, look, if you have a woman with breast cancer and you give them these estrogen blockers, they get, even if they are very young, in the complete menopause. And what is menopause? They have depressions, they have the skin is, the hair is suffering, all that what makes sleep is suffering. So what makes life nice is going, because that is a kind of a andropause or menopause, and that is aging in high speed.
Right. So in some cases, the treatment is worse than the disease.
Yeah.
Yeah. It's what I learned in the treatment of conventional chemotherapy from Dr. Stefan and our oncologist, Dr. Yam, is that interestingly, when you take a chemotherapy, the chemotherapy really only works in the first 20, 30 minutes, and it does its job and kills the cancer cells and some other things too. But the compounds stay in your blood and cause some damage for some time to come. So I wanted to ask Dr. Stefan, is there any possibility of developing protocols to maybe do a quick chemotherapy and then get rid of all those damaging compounds after the chemotherapy does its work?
Together with an American company, we have developed a system to extract, more or less, these cytotoxic compounds after treatment. And it is in that way that the patient get maybe an individualized treatment, working for about 20 minutes, working for about 30 minutes, and then we were able with a special device to extract such strange substances like carboplatinums and so on, more or less completely from the blood. And this offers a lot of opportunities. On the one side, these older treatments due to guidelines that's the reason why it is so often administered. It is very cheap. Carboplatinums are very cheap substances, but they produce instantly neurological diseases, numbness and not able to move. And therefore, it is very much recommended to extract them directly from the blood. On the other side, a lot of these new targeted substances have also a lot of side effects. For instance, if you try to inhibit ERBB2, that's a marker of breast cancer, then you run into a problem because ERBB2 is normally used in the healthy organism, and if you block it totally with a treatment, you run in that problem that healthy cells have no communication system. That is called a side effect. And therefore, also in that case, it is recommended to remove these substances from the bloodstream, after a short time of treatment.
So kind of like a chemo wash, Dr. Stefan?
Yeah, exactly.
Okay, well that's great. That's a great innovation. We look forward to having that operating in our clinics. And we have just a minute to go. We've been a little bit late with lunch, but we've been following Dr. Patanar's protocols of intermittent fasting. So we'll be giving you some lunch soon. But for the last minute, I just wanted to ask Dr. Yam, in the final phase of getting treated, we have two really great islands in Thailand, Koh Samui and Phuket, and we have two really great centres there for the post-treatment of cancer in the Miskawan Villas and in Shivit Wellness Resort. How important it is for these cancer patients to finalise their treatment with a good mental outcome and have a good break at the end of the treatment.
And now we have more data that there is a link before our bodies and mind, the stress and immunity. So most of all, the cancer is a defect in our immune system. So to recover the immune system, the first step, we should not add more artificial, like the chemicals or whatever. That is why we see the innovation in cancer treatment move for the drug, like a chemical to the targeted treatment, and then to cell therapy. Now we have NK cell therapy, but NK cell therapy need to combine to other. In the future, we will use the cell therapy. So cell is a biological agent. This is why the good environment make us have a good health, and then we can recover from the stress, and we have a special program to improve your organ that got damaged from the chemotherapy or other kind of treatment.
Right. So the let's say the final stage to have a good level of relaxation, good nutrition, that's critically important in the treatment of cancer.
Yes.
So that's all we have time for today. I've learned a lot about the prevention and treatment of cancer. I hope you have as well, with Dr. Wessolly and Dr. Emon and Dr. Stefan and Dr. Yam. Thank you so much for coming here today. And there's going to be more from Dr. Stefan later in the day. So if you'd like to learn more about the Metavectum test, please go to his session in the afternoon. Thank you very much, doctors. We very much appreciate it.
And also thanks to our moderator, Mr. David. Once again, thanks to our panelists for that insightful session. Ladies and gentlemen, we have learned a lot from our experts throughout this morning, receiving new clarity and awareness on the importance of functional medicine and how it will help shape or perhaps change the medical and wellness world. We do have a lot of topics coming out throughout the day. For instance, understanding the effect of kissing disease now and treatment for the future. We do have a topic on how balancing your hormones contribute to longevity, and also mind and energy medicine. We actually have 12 topics which will be running throughout the afternoon. So I hope you have checked, made a tick on the list that has been provided at your tables. Please hand it to our staff or just leave it there. We'll collect it while you're having lunch. A book launch will be coming up towards the end of the day as well. That's The Future of Healthcare for Humanity, and not to be missed is a networking session. For now, ladies and gentlemen, I'd like to call upon the director of Miskawan, Mr. Paul Kenny, to say a big thank you to our sponsors. And Mr. Kenny is here. A big round of applause, please.
So thank you, everybody. And we really appreciate all of you taking the effort to come here today and to join together as a community around functional medicine. I know myself, I feel very committed to functional medicine, and I feel great to be amongst a lot of people who also feel connected to functional medicine and its importance in the future for humanity. As you can imagine, it's quite an expensive exercise to bring together an event like this, to bring international quality speakers from overseas, and to provide with the great food and so forth that we will have for lunch shortly. So I did want to take a few minutes just to acknowledge 15 sponsors who shared in the vision of this event and have contributed towards the costs of the occasion. So Anantara Siam Bangkok Hotel, Avanti Health and Technology, Buddha Girl, Rejuvis, who is the Icelandic water that you have on your tables there, Isengard 24, IST Metz C, Surindorn Kempinski Hotel, Live Younger Now, LS Horizon, the Mayfar Luang University in Chiang Rai, Miskawan Villas on Samui, Pacific Healthcare, known as VitaShore, Quantum Evotech, RV Intertrade, also RV Lab, and Saluba MD Thailand. Thank you so much for your contributions to today, and please join me in a round of applause for them. So we thank you for your sponsorship, and we hope you'll join us in next year's even larger and more expansive event. Thank you.
Thank you very much, Mr. Kenny, Director of Miskawan. Up next, we have a special award presentation, ladies and gentlemen, that is in recognition to services for the functional medicine. And for now, I'd like to call upon Mr. Warit Taifa Yongwichit, Managing Director of Miskawan Health Group, to present the awards. And the winner for this award is Dr. Patana Teng Amnoi, nephrologist and anti-aging specialist from Bangkok, Thailand, receiving this special award in recognition for services to functional medicine. Congratulations, exceptional work, and we did really enjoy his presentation today. Please.
Thank you so much, Miskawan Group and Global Wellness Summit, for presenting me this award. To receive this award, it means it's a long line of working to call me the father of whatever is not good enough. You have to call me grandfather, actually. But I cannot do it alone. So there's a lot of people I need to thank. I have to start with Dr. Pakpilai Tuwisins for introducing me to the world of anti-aging medicine. And I also need to thank Dr. Mat Mai Prasad for helping me setting up the programs of anti-aging medicines and regenerative medicine at Thurakit Bandit Universities. Of course, I need to thank Thurakit Bandit Universities for allowing us to open up these programs over 10 years ago. I'd like to thank Payathai 2 Hospital. It's not easy to be a functional medicine doctors and working among conventional medicines. And Payathai 2 Hospital welcome me, whatever craziness, ideas, and whatever I have. And I can practice both functional medicines, anti-aging medicines, all in one among conventional medicine at the Phayathay Hospital. So I have to thank them. I have to thank all of my students today. I cannot be a teacher if they don't call me one. I can give a lectures, but they don't feel like I'm their teachers, then I'm none. So I like to thank my students. I learn from you as well as I learn from the books and textbooks. And also, who is my teachers? The entire, my life. My life I learned from my patients. The patients are your best teachers, believe me. So I have to thank all of my patients, some of them gone and some of them still with me. I went to see my patients in the morning and I know they're so happy to see me and I'm happy to see them. I learned from them. You can get medical schools, you can get medical degree, but you cannot be a doctor unless you save someone's life and help someone to get better. That's the definitions of being a doctor. Again, thank you so much for everyone. We're going to join force today. Somebody asked me the futures of functional medicine. You know, here we have two groups of people, I'm sorry. One seeking for health and one seeking for wealth, right? Oh, you are welcome, both of you. We share the stage together. But let me say the last words. Healthiest people are the wealthiest people in the world. Thank you.
Well said, Doctor. Thank you so much and congratulations once again. And last but not least, I'd like to call back to the stage Ms. Ellis, Chair and CEO of Global Wellness Institute, to tell us more about the table topics. So, please.
Thank you. I know we're all ready for lunch, and one of the traditions that we do at our Global Wellness Summit and at our symposiums is to have a topic at lunch for you to discuss. And it occurs to me this morning has been fantastic. We've heard from so many experts, so many doctors, so many people who are doing such great work. So I would like to present the topic that I would like to suggest you discuss a bit amongst yourselves for lunch that is very different than what we've heard about this morning. Not so medically oriented, but a little bit more about marketing, because all the good things that you do, we need to get that word out so more people know about functional medicine. So I would like to just suggest that the table topic at lunch, and there's someone I think at every table from Miskawan who will take some of the ideas that come from the lunch discussions back to David, and so how together we might be able to get the word out about functional medicine. So that's my suggestion, and in the meantime, enjoy lunch, and we'll see you, Bunny, after. When we finish lunch, I don't know if you're going to be here or not, but...
I won't.
You won't. Okay, that's what you're going to tell us now, right?
All right.
But anyway, enjoy lunch.
Thank you. A big hand for Ms. Ellis, please. Well, okay, it's time now for lunch, ladies and gentlemen. Lunch will be served in this room, and as Ms. Ellis has mentioned, there will be sessions coming up throughout this afternoon, and we have 12 sessions to be run concurrently. If you haven't actually checked the boxes on the list, please do so. The staff will be coming to your tables to collect the lists in a short while. And for the afternoon sessions, the symposium will resume at 2:05 p.m. That is 2:05. So please come back, not to this room. I mean, you'll have to make your way to the rooms. They'll be held in separate rooms, which will be across this ballroom. If you're not sure of where to go, we have staff who will be readily available to assist you. So for now, do enjoy your meals, and that's going to be it for me. It was a pleasure to be here, and have a great conference. As for now, สวัสดีค่ะ